Welcome to a deep dive into a fascinating world. It's not your typical health podcast. We're talking medical anthropology.
Yeah, get ready to see those textbook definitions of health and illness in a whole new light. We're going beyond the doctor's
We
office
really are.
and exploring how your body, yes, your asterisk body, reflects broader social and political realities.
It's a perspective that might surprise you. For example, did you know that in Uganda, there's a belief that just living near someone, being close to them, allows you to inherit their
Is
characteristics?
it true?
It really makes you think about how deeply intertwined our bodies and our social worlds really are.
Absolutely. And that's what medical anthropology is all about, understanding the body as multifaceted. It's not just the physical stuff, but how our individual experiences, the societies we live in, and even global power dynamics impact our well-being.
Okay, so let's unpack this multifaceted body idea a bit. You've got the personal body, which is all about how our upbringing, our cultural background shapes our sense of self and what it means to be healthy. Like that example from Uganda, it highlights how different cultures view the body and its connection to the world.
And then you've got the social body, which gets into how our bodies become symbols for these shared values and anxieties all within a society.
So we're talking about like how we present ourselves to the world, our clothing, hairstyles, even body modifications.
That's part of it, but it goes deeper. Think about the anthropologist Mary Douglas and her work on purity and pollution. She argued that these deep-seated cultural fears about order and disorder can actually manifest in how we view and regulate our physical selves.
So a culture obsessed with purity might have strict rules about, say, food preparation or bodily fluids because those things represent these potential threats to their social order.
Exactly. It's a way of managing those anxieties on a physical level. Now let's add another layer, the political body. This is where things get really interesting because it's about how social structures like hierarchies and power dynamics directly impact our physical experiences and health.
It's like who has access to healthcare, who's exposed to environmental hazards, whose labor is valued, and whose is exploited.
Precisely. And it's not always about intentional harm. It's often about these systems that prioritize profit or maintain existing power structures, even at the expense of people's well-being.
And those systems can influence everything from our risk of chronic diseases to our very understanding of what it means to be healthy in the first place. Take, for example, the pressure to conform to certain body ideals, the perfect body that's constantly being marketed to us.
Right. Those ideals are often driven by economic factors. A whole system designed to make us feel insecure, so we'll buy products, even if they're detrimental to our health.
It's a perfect example of how the personal, the social, and the political all converge in our bodies. And that brings us to a crucial distinction in medical anthropology, the difference between illness and disease.
Because they're not always the same, are they? We often use the terms interchangeably. But illness is the subjective experience of feeling unwell. It's your personal story. Disease is the objective diagnosis within a medical framework.
So a doctor might diagnose me with, say, a stomach ulcer, that's the disease. But my experience of that, ulcer's the pain, the lifestyle changes, the emotional stress, that's my illness.
You've got it. And those experiences are shaped by a whole host of factors, your culture, your personal history, even your social circumstances. Anthropologist Arthur Kleinman explored this in his work on illness narratives.
He found that the stories patients tell about their illnesses often differ from purely biomedical perspectives. It's like the doctor sees a malfunctioning organ, but the patient is living through this whole narrative of pain, disruption, fear, all shaped by their unique context.
And sometimes those narratives don't fit neatly into those Western medical categories, which can create real challenges for diagnosis and treatment. There was this study about Pakistani women in Norway experiencing symptoms that just didn't line up with conventional Western diagnoses.
It's like their bodies were telling a story that Western medicine wasn't equipped to hear. Which leads us to this fascinating concept of medical pluralism, the idea that different healing systems can coexist within a society, each with its own methods and beliefs.
And this isn't just about folk medicine or far-off cultures. Think about Mauritius. They have 9 different medical systems thriving there. You've got Western biomedicine alongside traditional Creole healing practices, Indian Ayurveda, Chinese herbal medicine. It's a true melting pot of healing traditions.
It's amazing how these systems coexist, sometimes even complementing each other. Speaking of which, I heard you witnessed a healing ritual in Mauritius. What was that like?
It was an incredible experience. I was with a Creole healer, a Longanese, and 2 women seeking his help. We went to this old cemetery at dawn.
Okay, this is already fascinating. Tell me more.
The healer, Michel, brought a rooster, some incense, and various offerings. He laid them out on a tune and began chanting in this almost otherworldly language.
Right.
Then, well, he sacrificed the rooster.
Wow, rooster sacrifice at dawn in a cemetery. That's powerful imagery. What were these women hoping to heal? Was it purely physical ailments?
You know, it's interesting because their ailments were actually rooted in their social circumstances. They both worked as domestic workers for these wealthy families and felt mistreated, really taken advantage of.
And that manifested in physical symptoms.
Exactly. We're talking rashes, insomnia, just this constant feeling of being unwell. They believed Michel, the healer, could cleanse them of this negative energy stemming from those fractured relationships.
So they were seeking healing on both a physical and social level. Fascinating how those are so intertwined.
Exactly. It highlights that sometimes healing goes beyond just addressing those physical symptoms. Sometimes you need a different approach, something more to mend what's broken on a social and spiritual level.
That makes sense. Biomedicine might be great for a broken leg, but for the kind of wounds they were experiencing, a different approach might be needed. It really shows how important it is to consider the whole person, their social world, their beliefs, everything.
Precisely. It shows how intertwined our bodies and our social realities truly are. And sometimes those realities, they can create conditions that are, well, toxic to our health.
Which leads us to the concept of structural violence, right? It's not something we typically think about when we think about health and illness.
Right. It's a powerful term, coined by medical anthropologist Paul Farmer. He argued that social inequalities, historical injustices, these things that might seem distant or abstract, they can actually create the conditions for suffering and poor health.
It's like we often think of violence as something very direct, one person harming another, but structural violence is more insidious. It operates on the societal level, systematically disadvantaging certain groups and impacting their well-being in these really profound ways.
Exactly. And the consequences are all too real. Farmer's work in Haiti is a powerful example of this. He showed how poverty, political instability, unequal access to healthcare, it created this perfect storm for the spread of diseases like HIV and tuberculosis.
Yeah.
It's like these social structures themselves become breeding grounds for illness.
And it's not just in Haiti. We see this playing out globally, how social and economic forces shape health outcomes in these often invisible ways.
Absolutely. Think about the last time you bought a package of strawberries or blueberries.
Okay.
As anthropologist Seth Holmes shows in his research on Mexican migrant farm workers in the U.S., that affordability often comes at a hidden cost. The exploitation of workers and the environment. The grueling conditions, lack of healthcare access, even their immigration status, it all contributes to a higher risk of injury and illness.
It's like their very bodies bear the burden of those inequalities so that we can enjoy those fresh berries. It's a sobering thought.
It is. And it's easy to overlook those hidden costs when we're so disconnected from the source of food, our products, everything.
Absolutely. It reminds me of anthropologist Alex Blanchette's work on the meat industry, Porkopolis. He shows how that cheap meat we often take for granted, it's only possible because of this system that exploits both workers and the environment.
Exactly. It's all interconnected. And that brings us to another fascinating, albeit troubling area of study within medical anthropology, the anthropology of poisons and toxins.
Okay, this sounds a little ominous, but I'm intrigued. What can you tell us about that?
Well, you know how globalization and industrial practices have created all these products and conveniences in our lives?
Right. It's easy to forget there's like a whole other side to all those conveniences.
Exactly. And, with those conveniences often comes exposure to these harmful substances. Pesticides, microplastics, industrial waste, all this stuff just seeping into our environment, our bodies.
It's like we're all swimming in this toxic soup, but not everyone is affected equally, right?
Unfortunately not, no. The poor, those marginalized communities, they often bear the brunt of these environmental hazards. They might live closer to polluting factories, lack access to clean water or health care, or even just have limited choices when it comes to the food they consume.
So it's like structural violence, but
Yeah.
on this whole environmental scale, these systems create these toxins and then disproportionately expose certain groups to them.
Precisely. And it's not always unintentional. Research has shown that sometimes food, particularly in countries with lax regulations, is deliberately contaminated.
Wait, deliberately? Why would anyone do that?
It often just boils down to these economic pressures. For instance, anthropologist Camelia Dewan's research in Bangladesh, it revealed that much of the food sold in markets there is contaminated with lead, pesticides, even crushed bricks, engine oil.
Crushed bricks, engine oil. That's just, I mean, what's the point of adding that to food?
Well, some of these contaminants are byproducts of industrial processes, but often they're deliberately added to prolong shelf life, to artificially ripen produce, basically anything that maximizes profit, even if it risks people's health.
It's a terrible thought, this toxic cycle where profit just overshadows basic human well-being.
It is, and it creates this vicious cycle where the people most susceptible to these toxins are the least equipped to avoid them.
Yeah.
They might not be able to afford organic food or live in these less polluted areas. It's a tough reality.
It's this hidden world of injustice, isn't it? Like, even our old electronics contribute to this.
You've hit on another disturbing trend, the global trade in electronic waste. Developed countries often ship their old computers, phones, to developing countries where they're dismantled, frequently in these hazardous conditions, exposing workers to all sorts of toxic materials. It's like we're exporting our toxicity along with our trash.
It's a stark reminder that even our seemingly insignificant choices can have these far-reaching consequences. And speaking of far-reaching consequences, it's hard not to think about the COVID-19 pandemic in this context.
Absolutely. The pandemic really brought into sharp focus how interconnected our health and our social structures truly are. It exposed these existing inequalities in a really brutal way, with minorities, the poor, being disproportionately affected.
And it wasn't just about, like, pre-existing conditions or access to healthcare. It was about who could afford to stay home, who had jobs that allowed for social distancing, who had, those safety nets to fall back on when the economy took a hit.
Precisely. The pandemic, it just magnified all these pre-existing social and economic disparities. It was like the virus itself didn't discriminate, but our society certainly did.
It's like Paul Richards' work on the Ebola outbreak in West Africa. He highlighted how a lack of cultural understanding actually hindered the initial response. They came in with this purely biomedical approach, which kind of backfired because they didn't take the time to build trust with these communities, to understand, like, the cultural significance of practices like funeral rites.
Exactly. It's a reminder that addressing health crises effectively requires understanding the social and cultural context. Sometimes the most effective solutions come from collaboration, from respecting these different ways of knowing and healing.
It's about recognizing that our bodies aren't these isolated entities. They're products of our history, our cultures, our social structures. This whole deep dive has really highlighted that interconnectedness for me. It makes you stop and think.
Yeah.
Where do we asterisk see these interceptions between health and inequality in our own lives?
It's a question we should all be asking ourselves. We've explored how these global systems, these social structures can be toxic. But what about the structures in your own life? Where do asterisks see health and inequality intersecting? That's something to ponder.
That's a powerful thought to leave us with. Thanks for taking us on this deep dive into the world of medical anthropology. It's definitely a field worth exploring further, and I encourage our listeners to do just that. Until next time, keep asking questions and stay curious.